Who is Sigmund Freud? Let's get to know one of the greatest contributors to psychology and known as the father of psychoanalysis. Sigmund Freud was an Austrian neurologist and the founder of psychoanalysis, a clinical method for treating psychopathology through dialogue between a patient and a psychoanalyst. He was born in Freiburg in Moravia, now the Czech Republic, to Jewish parents and grew up in Vienna, Austria. Freud studied medicine at the University of Vienna and specialized in neurology. He became interested in the field of psychology after reading the works of French neurologist Jean-Martin Charcot, who was using hypnosis to treat patients with hysteria. Freud began his own research on hysteria and developed the technique of free association, in which patients are encouraged to speak freely about their thoughts and feelings, without censorship or self-censorship. In 1895, Freud published his major work, Studies in Hysteria, which laid the foundation for psychoanalysis. He developed the theory that human behavior is mostly influenced by unconscious motives and experiences from early childhood, which shape our personality and behavior. He believed that psychological problems arise when there is a conflict between our conscious and unconscious desires, and that psychoanalysis could help patients uncover these conflicts and resolve them. One of Freud's most well-known theories was the Oedipus complex, which suggests that young boys have unconscious sexual desires for their mothers and see their fathers as rivals. He also introduced the concept of the ID, ego, and superego, which are three parts of the human psyche that work together to influence behavior. Freud's theories and methods were initially met with skepticism and criticism, but he gained a following in the early 20th century, and psychoanalysis became a popular form of therapy. Freud's work had a significant impact on the fields of psychology, psychiatry, and cultural studies, and his ideas continue to influence contemporary approaches to therapy and psychoanalysis. Freud's methods and theories sparked controversy in his time, with many rejecting his ideas as unscientific or immoral. However, his work laid the foundation for modern-day psychoanalytic and psychological research. Freud's personal life was marked by tragedy and turmoil. He lost his father when he was young, and his relationship with his mother was complicated. He married Martha Bernays in 1886, and they had 6 children together. Freud suffered from cancer of the jaw in his later years and underwent several surgeries, which left him in chronic pain. He died in London in 1939, at the age of 83.